Native American Culture, presented by Christine Harrison, Morgan Para, Pamela Maravich, and Jennifer Lilly, April the 24th, 2016. The goals of this presentation is to give insight on how to provide culturally competent nursing care that aligns with Native American culture values, beliefs, and practices. We aim to reduce healthcare disparities, morbidity, and mortality rates within the Native American culture. According to the U.S. Census Bureau 2012, there are approximately 5.4 million American Indians and Alaska Natives that identify as Native Americans. Native Americans live within and identify with tribal communities, and according to the Bureau of Indian Affairs 2012, today there are over 566 federally recognized tribes throughout the United States. 82% of those live in the western part of the United States. They have a higher mortality rate than other Americans, and all federally recognized Indians are entitled to health care through Indian Health Services. Childbearing women and their families historically have been allowed to deliver their babies alone in a quiet place, and men were not allowed to be present. The Saushore tribe allows mother and grandmother to attend the birth. The Navajo tribe holds on to sacred items or chant during delivery. Many tribes had rituals to protect the new baby. Navajos buried the placenta to protect the newborn from evil spirits, and the Saushue buried the umbilical cord to ensure certain character traits, ambitions. Others require a new mom to plunge the newborn into river every day for first 2 years of the life of the baby to keep it healthy. Nursing considerations is when taking care of a Native American mother and her newborn, you keep the area quiet and minimize number of male staff in the room, and allow sacred items to be held if requested. Also, ask ahead of time if mother and family would like the placenta or umbilical cord after delivery. Discuss signs of fluid in the lungs for child, rescue breathing, education, and temperature regulation. Also, the Saushue tribe requires mom to live alone with baby for 1 month to foster a bond. There are also dietary restrictions. New parents must refrain from red meat for a few weeks after birth of the baby. They also have a naming ceremony that is held several days after a baby is born. Nursing considerations is it may take longer to get the name of the child, and be mindful of meal options for family after delivery. Mothers expected to return to their duties quickly after delivery by swaddling and strapping the newborn to their backs, more likely to use a sling. Also, another consideration is mothers may be very active and resistant to rest or being taken care of. Considerations for the Native Americans during childhood is the communities view children as sacred. Transition from youth to adult influenced by rich culture and networks to enhance interdependence and obligations to care for one another. The intergenerational relationships allowed in the Native American elders to pass down stories and practices that convey values. Nursing considerations should be to restrict visitors at a time of illness may worsen illness due to isolation and lack of belonging. We must allow the family and the healers to visit to promote the healing process for any Native American. The Western Apache people view therapeutic landscapes as sacred places that connect humans with spiritual realms. These places enhance healing for those suffering from mental illness. This suggests that healing and treatment must incorporate a deeper cultural process to enhance well-being. Nursing considerations for children suffering from mental illness may require an approach more inclusive for cultural variances. Also, once they enter into adolescence, the Native American are known to have significantly greater stress related to social and economic factors than their white peers. There are 3 common stressors in the adolescent Native American: burden of expectations, relationship disruptions, imposing feelings and actions of others. The healthy stress management techniques to educate the Native American adolescent on is engage in meaningful activities, find healthy balance in relationships, connect with nature, connect with the Great Spirit, and choose a positive attitude. Only a small percentage of annual funding is allocated to mental health treatment. Historical trauma may attribute to high rates of domestic violence, child abuse, and substance abuse within the population. Nursing considerations would be embrace a Native American heritage, resiliency, and spirituality to encourage healing and resolve past pain. Group therapy may serve a similar purpose to some Native American rituals and ceremonies, and allowing patients to tell their story may facilitate communication. Substance abuse in the Native American is about 14.8%, and the population needs treatment for alcoholism. 6% of population requires treatment for other drugs. Morbidity rates are higher. Rates of alcohol-related deaths alone are double that of the non-American Native. Access to effective treatment facilities is limited. Treating Native Americans with substance abuse is very important. They have lack of cultural awareness can cause Native Americans to be offended or closed off during therapy. Individuals entering treatment may desire treatment programs that are more culturally specific and can attend to the needs of their communities. Many facilities focus on Western medicine techniques. Patients feel their traditional practices are being belittled, and their spiritual ceremonies are not valued as therapy. Push towards implementing evidence-based treatments in treatment programs, but these are not necessarily effective for treating minorities. More research must be done to find culturally specific EBTs for treatment programs. Native Americans will likely find more success in treatment programs that incorporate their cultural practices. Cultural attributes in the Native Americans. Historical events brought disease to their community. Their life expectancy is less than American counterparts. They have fewer opportunity for education. They have lower family income. They feel the healthcare providers have a negative attitude and are unfriendly, and they don't trust the healthcare provider. But they are entitled to healthcare through Indian Health Service. Their leading cause of death is diabetes, heart disease, cancer, unintentional injury, and cardiovascular disease. The older adult Native American must be allowed to speak in their own language with the assistance of an interpreter for the healthcare provider. They must be provided a friendly atmosphere. We must make their environment culturally friendly. We must allow extended time for interviews to build trust. And we must allow family and spiritual leader to be present. Plus, the elderly must be able to express his information in a storytelling event. Values for the Native Americans is their family, their customs, and nature. Their beliefs about health is a balance between mind, body, and spirit. Sickness occurs from an imbalance with nature, and they believe in sacred spirits, ceremonies, and tribal healers. We must provide a culturally friendly environment, avoid direct eye contact, and allow time to make decisions, have healers be a part of the interdisciplinary team, and work in collaboration with family and tribal leaders. Native Americans continue to have disparities in health, disabilities, and longevity. The healthcare system must improve the health and well-being of Native Americans by broadening our knowledge about their culture and beliefs. This will ensure that Native Americans are able to collectively take an active approach in making the appropriate lifestyle changes that will decrease and/or eliminate inequalities and health disparities. Healthcare professionals and Native American community leaders can work together to develop culturally sensitive interventions that will change social policies to improve their health and wellness. Native Americans can become a strong, healthy nation with the help of the health care community. Thank you.